Embolism pulmonary. When a central blood channel in the lungs becomes unexpectedly clogged, pulmonary embolism occurs. The blockage is usually caused by a blood clot. The size of the thrombi is usually not lethal, but it can certainly harm the lungs. However, if a blood clot is large enough to block a major blood vessel and prevent blood from getting to the lungs, the consequences can be devastating, and prompt treatment can save the affected person's life and minimize future consequences and harm. Symptoms of pulmonary embolism. The following are the most prevalent symptoms of a pulmonary embolism. Shortness of breath that occurs suddenly. Sharp chest pain that gets worse when you cough or take a big breath. A cough with pink sputum that is foamy. Symptoms of anxiety, tension, or anxiousness in general. Sweating excessively. Vertigo. Feeling dizzy. Palpitations or an increased heart rate, palpitation. If symptoms similar to the ones listed above arise, seek medical help right once, especially if the symptoms have suddenly become more severe. Pulmonary embolism causes and risk factors. Pulmonary embolism can be caused by a variety of circumstances. The most common cause of pulmonary embolism is smoking. A pulmonary embolism is most commonly caused by a blood clot that forms in one of the legs, then breaks free and goes to the lungs. A blood clot on the skin's surface usually causes no difficulties, but blood clots that form deep in the tissues, such as a thromboembolism in internal veins, can result in a pulmonary embolism. Factors that make pulmonary embolism more likely. A blockage in the blood vessels can be caused by a variety of circumstances, including tumors with cancer. When a bone fracture occurs, various fluids, such as amniotic fluid or fatty deposits, enter the blood arteries, however these situations are uncommon. Pulmonary embolism complications. The following are serious pulmonary embolism complications. Sudden cardiac arrest and death. Shock. Heartbeat irregularities. Acute pulmonary embolism. Pulmonary artery hypertension. Fluid buildup in the lungs. Diagnosis of pulmonary embolism. Pneumococcal embolism is difficult to diagnose, and the reason for this is that the symptoms of pulmonary embolism are extremely similar to those of many other disorders, such as heart attack, anxiety attack, or pneumonia. The doctor makes the following diagnosis. Physical examination. Number 1. The attending physician conducts a thorough physical examination and examines the patient about his overall health and other symptoms connected to the symptoms he is currently experiencing. These tests assist the treating physician in determining whether the patient is at risk for pulmonary embolism. 2. Imaging and laboratory testing. Tests may be required to detect blood clots in their locations, or to rule out other reasons causing the same symptoms, depending on the severity of the symptoms. Regular examinations include laboratory tests, imaging with ultrasound, computed tomography, CT, ECG, electrocardiogram, MRI, magnetic resonance imaging. Treatment for pulmonary embolism. In most situations, anticoagulant medications are used to treat pulmonary embolism. These drugs are primarily blood thinners, but they do not dilute the blood, rather, they inhibit the formation of new blood clots and reduce the size of existing clots. A person who has previously experienced a pulmonary embolism is more likely to experience one again. Anticoagulants help to prevent blood clots, but they also raise the risk of bleeding. Some people are unable to take anticoagulant medications, or their bodies do not respond to them, causing blood clots to form despite treatment. A filter may be introduced into a major blood vessel, such as the inferior vena cava, which is responsible for blood transfusion from the lower body to the heart, to prevent future medical issues, since the vena cava filter prevents blood clots from reaching the lungs. Preventing pulmonary embolism. Prevention of blood clots and pulmonary embolisms. Take anticoagulant medication every day to prevent pulmonary embolism. Paying close attention to beginning activity as soon as feasible after surgery. Wear a pressure pouch to avoid thromboembolism in the deep veins of the foot, especially if you are in the high-risk group for infection, such long-distance travelers. While aspirin can help prevent blood clots, it is not an effective treatment for pulmonary embolism. Make a conscious effort to stand and walk for a few minutes every half hour or hour. Pulling the fingers towards the knees and then tightening them again to move the palms of the feet. Drinking enough of fluids while traveling long distances. Paying attention to the fact that the clothing around the waist and legs are not bonded to the body. Avoid ingesting caffeinated alcoholic beverages, as these drinks cause the body to lose fluid faster.